Hello, my name is Jerry McDonald, and I'm a certified senior advisor with Oasis Senior Advisors, South Florida. And I'm here today to talk to you about how does one pay for long-term care costs? It's a question that's always on everybody's mind as they start exploring senior living options. And when I talk about long-term care and senior living options, I do mean assisted living, memory care communities, independent living, perhaps with support services, nursing home level of care. One of the most often asked questions I get is, doesn't Medicare pay for long-term care cost? And unfortunately, it does not. Medicare is a federal insurance program for those 65 years of age or older, or someone who qualifies for it through disability, that covers medical costs such as hospitals, doctor visits, lab, x-ray, certain inpatient, outpatient services. Um, and it's for medical cost. So then someone says, well, if Medicare doesn't cover long-term care costs, who does? And it is a personal expense. So this is where you look at your own resources to cover the cost of your long-term care. So people would have to look at um, savings, investments. Does one consider selling their home to use that cash for their care? Um, Medicare is still in place. It doesn't go away. And you might be living in assisted living, and you have a doctor who comes sees you there, the podiatrist or the routine doctor that's there. Those services can still be billed to Medicare. You may have lab work done. So those things stay in place and Medicare pays for those things. But they don't pay for your apartment. They don't pay for someone to manage your medications. They don't pay for someone to come in and help you bathe and get dressed. So that's where it is important to understand. Then someone says, well, are there any other options? There may be things that are available to you that may help bridge some of the cost in long-term care. If someone's purchased a long-term care policy, that's a great resource. It's important to pull the policy out, update yourself on its coverage and limits. Then there's a benefit through the Veterans Administration called the VA Aid and Attendance. So someone has to be a veteran to qualify, or their surviving spouse. There are regulations around it and financial criteria. The veteran must have had an honorable discharge and must have served at least one day during wartime. May have not been an active battle, perhaps had a desk job somewhere, but it was during an active wartime. Obviously, there's rules and regulations, and the application process is complex. We would recommend you to use somebody who's trained and knowledgeable in that. And as a senior advisor, we could help connect you to someone who does that. But it's a great benefit if you qualify. The benefits paid directly to the veteran or surviving spouse to be used for living and care cost. The other program that's out there for people is Medicaid. And Medicaid is different than Medicare. Medicare is your medical insurance, and Medicaid is a state program that does help cover the cost of long-term care. It's sort of a safety net. There's obviously rules and regulations around it. There's financial criteria and clinical criteria that one must meet to get the benefit. It's a state-run program, so every state has different Medicaid rules and benefits. So in the state of Florida, there is a benefit for assisted living care. And in Louisiana, Texas, there is not. So we always would encourage you to use the expertise of an elder care attorney to advise you about Medicaid in your state. The rules are complex. Sometimes it's more about Medicaid planning to be educated in the future, so what you know what decisions that you could make. Whether you think you may ever qualify or don't need that service, it's good to be educated about it so you can make the best decision for you or your loved one. Within our network here in South Florida, we work with several elder care attorneys that specialize in Medicaid and understand the rules around that. It's also complex if you're married and one spouse needs long-term care and the other one does not. Another good reason to seek the advice of an elder care attorney. Everybody's financial situation is so different and unique. We would hope that you would reach out to us and want to talk to us about it, and then we'd be able to help better advise you and perhaps connect you to an elder care attorney or to someone to help you with the VA benefit. So it's a confusing topic, lots of moving pieces to it. It's important that you understand it and perhaps use somebody like myself as a certified senior advisor to be on your team so you can make the best decisions possible for you or your loved one. I'm going to share our contact information with you now so you can know how to reach us. So there's Candy Cohen, is the owner of Oasis Senior Advisors, South Florida. My information, and then Becky Dieter is another senior advisor on our team, and there is our website information. So thank you so much for watching today. There you can also find some other educational videos, such as why use a senior advisor or why consider assisted living over a nursing home on our website, Facebook page, and coming soon to YouTube. So thank you so much again for your time today, and hope you have a great one.